For vaginal estrogen, there's no window of timing. If you're 80 years old and your body has not seen estrogen in 30 years, you can still start local vaginal estrogen. It is not too late. You can start.
Hi, everyone. I'm Barbara, and this is Age Better. If you've been listening to or watching this podcast for the last 4 years, you know how much attention my guests and I pay to our hearts, brains, and bones, and, well, we should. Absolutely. But here's a question. Are you paying enough attention to your vagina? Because this is one area of our bodies that can change dramatically after menopause, affecting everything from comfort and sex to urinary symptoms and UTIs that never seem to stop. But it's also an area where a few relatively simple steps can make an enormous difference. And here's the part I really want women to hear. It is never too late to do something about it. This episode is a replay of a wide-ranging conversation about vaginal health with Dr. Margaret Nachtigall, one of my favorite go-to experts on menopause and women's health. We're talking about what happens to vaginal health in our 60s and beyond, the symptoms we should never ignore, what actually works, including vaginal estrogen, non-hormonal options, and pelvic floor therapy, and other things, and what every woman should be doing right now to protect this important part of her health. You may have listened to this episode when it first aired earlier this year, but it's never a bad thing to hear good information again. Before we get started, if you're enjoying Age Better, please follow or subscribe wherever you listen. Subscribe to the Age Better YouTube channel and share this episode with a woman who needs to hear it. And be sure to check out the Age Better Cheat Sheet newsletter on Substack, where each week I take an even deeper dive into some of the topics we cover here on the show. Okay, everyone, get ready to age better. Dr. Margaret, welcome back to Age Better.
Thank you. Hi, Barbara.
So today we're going to be talking about vaginal health, specifically for women in their 60s. So for women in their 60s and beyond, what are the most common vaginal changes that happen as a result of menopause?
First of all, in the 60s, 70s, and 80s, this is a time where many people have not been exposed to estrogen. So specifically for people who did not go on hormone therapy or have not been on hormone therapy for several years. So for those individuals, what happens over time is estrogen is sort of the nourishing hormone for the vagina and the vulva and the lower urinary tract. So without it, what happens is the vagina tends to get very dry. It loses its elasticity. The pH of the vagina increases because estrogen keeps the pH low. And what that means is that it changes the environment. So bacteria that can survive at that higher pH will survive. And so this puts people at an increased risk for vaginal as well as urinary tract infections. And then the symptoms of vaginal dryness, itching, burning, pain, less elastic, so it doesn't stretch well. And these are all the things that people can start to feel without estrogen in time. And it's progressive. It gets worse as time goes on.
So how do you distinguish, Dr. Margaret, between normal age and hormone-related changes like you just described, and those that are maybe a bit of a red flag?
Well, first of all, as I mentioned, typically these symptoms are gradual and come on in stages. If something is acute, if it happens right away, that would be something to reach out to your doctor about. A big red flag for me is vaginal bleeding. Anytime you see any blood, if you're not taking any hormone therapy and you see postmenopausal bleeding, that is something to reach out about. The other thing is extreme itching. If you're having extreme itching, especially in just one area, that is something to reach out about because that can be a sign of an underlying problem, either an infection or even a malignancy. if you take a look at the vagina or the vulva and you see an ulcer or a cut or something that shows up that you haven't had before, that would be something that I would advise you to get attention for. And then, of course, if you have urinary problems, if you have pain on urination, if you're urinating really frequently or you can't make it to the bathroom, those would be signs of a possible urinary tract infection. In addition, people that have change in bowel or bladder habits with lower abdominal pressure, that would be something that I would reach out about, because things like ovarian cancer, which really don't have a lot of symptoms, can have subtle things like that.
What questions do you wish that more of your patients who are in their 60s and maybe also 70s and beyond would ask you about vaginal health?
I think what I would love is for patients to feel really comfortable asking anything. Ask whatever is on your mind. Nothing is silly. Any question is a good question. What about leakage? What about pain? I'm having dryness. I really am having pain on intercourse or with sexual intimacy. Don't be afraid to ask if those are things that are affecting you.
Let's go on to tests now. Once you're in your 60s, certainly past 65, maybe you don't need all of those tests any longer or as often. HPV, pap smears, pH testing, or inflammation screening, anything like that. What say you, Dr. Margaret?
So I think the big thing is a exam is really helpful. I think having a pelvic exam can identify abnormalities such as lesions, conditions like sclerosis or thinning of the vulva, pelvic support, people that have uterine or bladder or even rectal prolapse. These are things that can be identified on a pelvic exam. While you're having a pelvic exam, that allows the healthcare provider to also examine the ovaries and the uterus and check for fibroids and check for ovarian cysts or masses. So I think a pelvic exam is helpful no matter how old an individual is. The PAP and HPV testing is something that has become a little controversial. And that is because the current guidelines say that over the age of 65, a woman no longer needs to get a PAP smear. I personally don't agree with that guideline. It is an individualized decision. And any person who is still having intercourse and having exposure to another person means that they could be getting HPV, skin-to-skin transmission. Someone that has more than one sexual partner, that also increases the chance of developing HPV. And there's no reason why they shouldn't have a very simple test, which is a pap smear or HPV testing. So I think a pelvic exam is a really good idea. So I'm not saying that every single person needs all of these tests, but certainly targeted to what the individual is experiencing, what their symptoms are, and then that way we can not only guide treatment, but guide evaluation.
So let's talk about some of the symptoms that women are, we kind of touched on it a few minutes ago, but some of the symptoms that they're really most embarrassed and uncomfortable to talk about: chronic vaginal dryness, thinning tissue, of course, which is happening, pain and burning sensations with sexual intercourse and the like. So what's going on physiologically? And then how does this affect more than just your sexual experience?
What I often hear is that my vagina feels like sandpaper. That is a very common complaint. Or I feel like my pants are too tight all the time. My vagina hurts day and night. Or my vagina only hurts during sexual activity. These are all symptoms: dryness, itchiness, burning. So first of all, you want to make sure that there are no infections at the time, but assuming that it's dryness or lack of estrogen. So estrogen does an amazing job of keeping the tissues alive and moist and increases the blood flow to the vagina and lowers the pH. By lowering the pH, that allows for bacteria not to grow. The other thing is estrogen allows for the collagen to be present in the walls of the vagina and the vulva and around the clitoris. So without that collagen, without the exposure to estrogen, the collagen decreases. And that's why you get that real thinning of the skin and you get that lack of the ability of the vagina to stretch. When you add back estrogen, that collagen comes back, the stretchiness comes back, the color comes back. It becomes more pink and robust and can actually go back to the way it was before menopause. So that's why estrogen is one of the main treatments for people with vaginal atrophy.
So how are vaginal changes linked to urinary symptoms? Like urgency, the sense that you just have to go to the bathroom, frequency, and of course, recurrent UTIs.
That same lack of estrogen is having the same effect on the urogenital tract. So just replacing vaginal estrogen can do an amazingly good job of coating the outside of the urinary tract. And so being on estrogen can decrease the likelihood of those symptoms and also decrease the incidence of urinary tract infections. I cannot tell you how many patients I have had that have come in with urinary tract infection after urinary tract after one another. Once they've had 3, I say, okay, let's just try some vaginal estrogen. They go on vaginal estrogen, and this is just local treatment, not anything that's going to get absorbed into the body. And it is incredible what a good job it does. And it has time and time again been a lifesaver for so many people. And urinary tract infections, particularly in the older individual, can be very problematic. Once you get one, you tend to get more and more, and they get harder to treat. So I think it really makes sense to be treating the symptoms early, and this can be so beneficial.
What are the most effective treatments for vaginal dryness and atrophy? Hormones, non-hormonal options, hormonal options, laser therapies, any other treatments, over the counter, coconut oil.
The first thing we're going to do is a history, figure out what are the symptoms, figure out if it makes sense in that particular individual. Then we're going to do an exam, make sure we don't need to get any cultures, rule out any kind of an infection. Once we are sure that this is a lack of estrogen and vaginal dryness, then we talk about what to do. And the over-the-counter products, there are moisturizers, there are lubricants. Hyaluronic acid does a fantastic job of decreasing the pH, bringing it back down to a normal level. So these all can be really helpful. And then I think we move into the hormonal options. Estrogen is amazing for vaginal dryness. It does an incredible job of bringing the vagina back to work, bringing it back to health. This is remarkable what a small amount of estrogen can do. The different options, there are vaginal creams that can be used, vaginal inserts, tablets. Some are on the end of an applicator and some are inserted with just a finger. There's a vaginal ring, which slowly releases estrogen throughout over 3-month period of time. And then you can self-remove the ring and insert a new ring. That's another option. So there's external creams, internal creams, tablets, suppositories. These are all local treatments that can be incredibly helpful. In addition, we have some non-estrogen aids. So DHEA vaginally gets converted in the vagina to testosterone and estrogen. And so that can do a fantastic job of alleviating all those symptoms of vaginal dryness. And the DHEA has no estrogen in it. So it also has a little bit of an effect on improving libido. It's nightly as opposed to the estrogen compounds, which are typically twice a week.
Right. That's when I take it twice a week. Yep. Mm-hmm.
But this is an individual decision. And often what I'll do is start with one option. And if a patient likes that, great, we'll continue. If they don't, we can switch to another one and keep working until we find one that works. Now, there is also an oral non-hormonal option for people, a sphenamine, which can be used to take by mouth to improve vaginal dryness. That has a little bit of an increase in clotting. So it might not be something that every person wants to use, but certainly is
Can
good.
I just ask you, is it considered more effective though? It's like, why would somebody take that?
There are some people that can't do the insertions of the estrogen vaginally. And so for those individuals, an oral option is nice. I think that for many individuals, an over-the-counter product might be a starting point, either a daily vaginal moisturizer or a lubricant during intercourse is sometimes used. And some people just use coconut oil. So everyone is different. Again, I like the hyaluronic acid. I like these hyaluronic acid suppositories. They're non-hormonal and easy to use. The lasers are still in a phase where they're not 100% proven effective or FDA approved. However, I have many patients who do really well with the laser treatment, and that is non-hormonal. It's a treatment, and then you do 3 treatments in the first year, and then every year you do a boost. And that can be great for someone who can't take estrogen. I think that, the question always comes up to me is, can I take estrogen if I had breast cancer? It's something that we discuss with the individual's oncologist or breast surgeon. In most people who have had breast cancer can still use vaginal estrogen. There's a very nice study comparing patients who had breast cancer, whether they were on or off vaginal estrogen afterwards, and there was no difference in recurrent episodes of breast cancer in the people who were using vaginal estrogen. The patients who have had breast cancer and are on an aromatase inhibitor, those patients really cannot take vaginal estrogen. And there are some people with estrogen positive tumors, whether they're breast tumors or other kinds, that even vaginal estrogen they can't take. So there are some people that can, but for the most part, most people can use local vaginal estrogen. And I think this might be a good time, now that we're talking about treatment, to introduce the group of people that did start using hormone therapy in their 50s and are continuing, because sometimes they too get a little bit of vaginal dryness because the systemic may not be quite enough for vaginal dryness. And so they can use vaginal estrogen in addition to the systemic estrogen that they're on.
Can you, if you are still on hormonal therapy, systemic, can you or should you consider topical vaginal estrogen as well?
You absolutely can. And many, many, many of my patients are using both. And then we started out talking about the 60s. So everyone's different. When we talk about starting hormone therapy, we want to start as close to menopause as possible, but certainly within the first 10 years. So there are 60-year-old women that are only 4 years from their last period. Their period may have ended at 56. Those people are still certainly candidates to consider going on hormone therapy. We like to start before the age of 60. We like to start within 10 years of menopause. Obviously, the sooner the better. We've talked about that. If you can start within 1 year, 2 years, 5 years, that would be ideal. And that's because we think that that is where you get the benefit to prevent heart disease and dementia.
Bone loss.
Well, bone loss, anytime you start estrogen, you're going to help the bones, right? Estrogen is going to at least maintain bone and may even allow you to improve bone. So certainly that is a great bonus to being on estrogen. But it also helps the vagina.
Yeah, I hear women talk about how they just simply will not go on hormone therapy, even if they are still in that window of opportunity, as we like to say, nor will they even try vaginal estrogen, all because of that study that came out. We all know about that. We talked about it a lot. This whole generation of women who went off, and doctors who just stopped HT. Women still aren't comfortable with estrogen. The percentage of, in the US, I'm talking about, of women who can take HT, who are, is, I think, like at about 14% or something, like very low.
Well, my prediction is that is actually going to change because I am seeing the reverse. Definitely 20 years ago, even 10 years ago, if I suggested hormone therapy to an individual, I was fought with surprise, alarm, and maybe didn't want to go on. Now I actually have the opposite. I have people coming in begging me to put them on hormone therapy, even if it's not appropriate. So I think what we're going to see is more and more individuals going on hormone therapy and more people in their 50s.
So there's a bit of a lag then, because it's been a few years since we've been having this more open conversation about HT. So, maybe it'll just take a few more years for women to really be comfortable.
Well, even in this year, this is the year that the FDA took away the warnings on vaginal estrogen on the label for worrying about breast cancer. So taking away that worry from people, taking away the label has made a big difference, I think, in the eyes of doctors as well as people who might be receiving hormone therapy. So I think we are seeing a change. And I think the fact that the FDA opted to remove those labels is very important and very important for us to see the safety of hormone therapy, the safety of systemic treatment, and the safety of vaginal treatment. And again, always, that I say this all the time, it's an individual decision. It's not just a decision, it's an individualized approach to who should receive hormone therapy and who shouldn't. And I think that is what is essential. Everyone should not receive hormone therapy. There are individuals who should not be on hormone therapy. I'm speaking about systemic treatment, people that have an increased propensity to blood clotting, people who have estrogen receptor positive tumors, people who are bleeding irregularly. These people who have liver disease, those are people that we want to caution and maybe shouldn't be on hormone therapy. People that have, for vaginal estrogen, it's different, much more lenient, and many, many more people can be candidates to be on local vaginal estrogen. And there's no window of timing. In other words, if you're 80 years old and your body has not seen estrogen in 30 years, you can still start local vaginal estrogen. It is not too late. You can start.
So let's talk about pelvic floor physical therapy. Who should get that?
So people that have, if there has been an extensive amount of dryness over time, and that has caused a real narrowing of the vaginal, what we say introitus, or the opening to the vagina, that is repairable with estrogen or lubricants and moisturizers, and dilators sometimes are important. And some people want to do this alone in their houses with guidance, but many people will go to physical therapists to be able to help them with this. And sometimes it only requires 1 or 2 sessions. There are other people that have pelvic floor muscle weakness or too tight, and those can really benefit from pelvic floor therapy.
And would you consider the squeezing of your vagina, the muscle, the Kegels, exactly, is that part of this, would you say?
And that's something that you can do on your own, is Kegel exercises. That Kegels, what you can do is you start urinating and then squeeze to stop the urine stream. That muscle that you use to stop the stream is what you're going to use to try to do. You can do 10 of them and then take a break, do 10 later on, take a break, etc. But yes, Kegel exercises are great, and physical therapists have even more exercises that they can help people do. And they often use moisturizers or lubricants, during their treatment.
So let's talk about lifestyle choices and supplements, specifically like collagen, which they say helps with nails and skin. So of course, we're talking about the skin of the vagina, omega-3s, probiotics.
I'm going to take the first part, which was lifestyle changes. So first of all, don't smoke. makes the vagina drier. So nicotine worsens the blood flow and it worsens the vaginal health. So for all millions of reasons, the answer is don't smoke. So that's number one in terms of lifestyle. The other is to maintain physical activity. Overall circulation, increasing blood flow, that's going to increase the blood flow also to the vagina. So that's helpful. It also helps with mood. And so why not, right? And then avoiding diabetes and keeping blood sugar in a good check. People that have metabolic syndrome and increased insulin and prone to diabetes, those people tend to have more yeast infections. So you can actually see vaginal infections as a result of the abnormal sugar levels. Getting enough sleep, trying to reduce stress. We don't really need supplements unless we're deficient in something. The only supplement that I typically recommend is vitamin D because so many people are vitamin D deficient. And in people who are getting frequent vaginal infections, I also recommend a probiotic, whether it's in something you eat like yogurt or in a supplement of probiotics. I have not seen direct benefits for all the other things that you mentioned, such as omega-3 and collagen. I personally cannot recommend them because I don't know that they actually do make a difference.
So what are your go-to suggestions for women who want to maintain or even revive a good sex life? Sex doesn't end after menopause, we hope. It continues on, both from a medical standpoint, which I think we've kind of covered with dealing with vaginal dryness and the like, and also an emotional one.
Right. It is. Absolutely. There are so many other factors that are happening at the same time. And so there are more stress. Stress in life can have a very big impact on sexual function. So I think that really plays a role. And here again, I think that looking to the experts, sex therapists, or other psychologists, relationship help, all of this is so helpful. And we're so fortunate that we have such great people who have been trained in these areas. So I would not be afraid to reach out if you're experiencing any of these. The one thing that I would say from what I do is to treat the underlying vaginal dryness, vaginal atrophy, or the genitourinary symptoms of menopause. Treating it and treating that and making the vagina feel better is going to be helpful and going to be improving sexual function. So I think that is where I would start and then expand on other managements. And then also overall health and well-being, controlling blood pressure, controlling diabetes, improving your mood. All of those things, I think, can be very important in improving sexual function. And then relationship, that can also be important, is talking about what you are experiencing, if there is a significant other that's with you, or if this is something that you feel comfortable discussing with if you have a partner, your partner, otherwise your therapist, whoever is going to be helping. I think that that's really helpful.
Yeah, that is so important. I mean, communicating what you're experiencing, communication is essential for good sex. And also, you pointed out something too, and this is a lifestyle thing. If you are taking care of your health in other areas, like working out, keeping stress at a minimum, because life is just a series of stressors. As we know, life is always changing. New situations arise, and it can be stressful. And certainly sleep. If you don't feel good, you're not going to want to have sex, no matter what is going on with your vagina. So dealing with all of these things is so important. And then, as you said, communicating. So we're still on the topic of sex. Now, we know that there's something called the silver divorce. The gray divorce rate is unfortunately a little high. So women might find themselves single And maybe they've met someone and maybe they're thinking about having a new sexual partner or partners. I mean, this is a reality. So what should they think? Because so many women I talk to, they think, oh, I'm too old to get an STI. Like, no, you're not. What steps should they take to protect themselves? What tests?
The protection, just like what they did when they were 30. There's really no difference. If it is a new partner, then using condoms is certainly a possibility. It's a little harder to use condoms when there's lack of lubrication, so extra lubrication might be helpful. And the other is to get tested. Certainly, if there's any suspicion, there's no reason you can't get sexually transmitted infection testing. And this is available at a lot of different places. Test for chlamydia, test for gonorrhea, test for syphilis, test for HIV, hepatitis, possibly HPV.
So what can a woman in her 60s start doing today, right now, to protect her vaginal health as she inches her way towards 70?
Well, I think get an exam, first of all. Ask whatever questions you might have. And if you're on hormone therapy, continue your hormone therapy is perfectly reasonable. And you may or may not want to add a vaginal estrogen to that. Or if you're not adding estrogen, you may want to add some hyaluronic acid, or you may not need anything at all. Some people really don't get vaginal dryness. Not every woman will. Many will, but not everyone. And so some people don't have to do anything. But I would start with an exam, get a pelvic exam, and would talk about any of your concerns, ask your questions, and then consider using an over-the-counter product, a moisturizer, a pH lowering like hyaluronic acid. If you do have symptoms, consider using topical vaginal estrogen if you're a candidate. If you're someone that has had breast cancer, talk to your breast cancer team, your oncologist, your breast surgeon, as well as your gynecologist, and see if it is okay for you. If you're on an aromatase inhibitor, it's probably not. If you're someone that might benefit from pelvic floor therapy, that might be good, or just regular activity, yoga, walking, whatever works. And then make sure that you're protecting your urinary system, meaning that if you have urinary symptoms, get checked for a urinary tract infection. Keep your underlying health as good as possible, maintaining adequate sleep and good nutrition and maintaining even blood sugars, all of those good things. Stay hydrated. That's really important to decrease urinary tract infections. So I think in summary, I guess what I said is exercise, don't smoke, stay healthy, and treat vaginal dryness in either over-the-counter or with estrogen or DHEA compounds. I just didn't even think of this before, but white cotton underwear can be helpful. Change your clothes after you go biking. That can sometimes be more uncomfortable.
Before I let you go, you must tell us, what are your top 3 takeaways? Because we covered so much. What do you want to make sure everybody remembers from this conversation today?
Don't be afraid to speak up. Get help. I think the other thing is that local treatment can be incredibly helpful. You don't have to necessarily be on systemic hormones. Local vaginal estrogen can be something that can be really helpful for many people. If you're having vaginal bleeding or extreme itching or you see an ulcer, get help. Don't wait. It's really never too late to get some help to improve the vaginal tissue and bring some life back to the vagina.
Thank you so much, Dr. Margaret.
Thanks so much for having me, Barbara.
Thanks, everyone, for tuning in. See you next week.
Thanks for tuning in, everyone. If you enjoyed this episode of Age Better Podcast, please do a few things. First, share it with all your friends and family. Then, subscribe to Age Better wherever you listen to podcasts, including YouTube, so you never miss a single episode. Finally, if you have ideas for topics you want me to cover in a future episode of Age Better, send an email to agebetterpodcast@gmail.com or reach out to me on social media. Until next time, remember this: We can't control getting older, but we can control how we do it. Talk to you soon. Age Better Podcast is a proud member of the Sound Advice Network. Sound Advice, women's voices amplified.